Hello. This is a great question. With an inferior MI, so an inferior MI involves the left ventricle, but the same blood vessel that feeds that left ventricle also rolls around the back of the heart and feeds the right ventricle, or branches of it feed the right ventricle. So it's probable, with inferior myocardial infarctions that there's also a right ventricular infarct. And as you know, your right heart, your right ventricle, pumps blood into the lungs, and it's very preload dependent. For right heart to function well, it needs a really good blood flow coming back from the body into the right heart. So if there's a chance that that patient has got poor perfusion and poor blood flow coming back into the heart, then they will provide fluid for these patients with an inferior MI on the premise that they might have right heart failure, secondary to a small right-sided myocardial infarction or a posterior MI. So they preload the patient's right heart. Now that's crucial for pushing blood through the lungs and into the left heart to be able to pump around the body. Otherwise, they're going to lose cardiac output, which is measured on the left heart. So we fluid load them or fluid volume load them to preload the right heart on the premise that the right heart is also suffering from ischemia or infarction in an inferior MI. So yes, you're going to see them probably be fluid resuscitated a little bit more aggressively than somebody with left heart failure, in which case that fluid can actually overflow and go into somebody's lungs, giving rise to a decompensated pulmonary edema. But that's another video. Hope that answered your question. Thanks. Bye.